Hello, Dr. Joe here of the drjoe.com and the 2020 from.com. In today's video, we are going to be observing Heart Health Month, okay? It's Heart Health Month, and in observance of this, I'm going to give you four tips to reduce your risk of heart disease, of developing heart disease. So that's what today's video is about. Now, if you're watching this video any other month, any day that you start watching this video, you should still observe it as your Heart Health Month. So it doesn't have to be specifically for this very month. Anytime you watch this video, use it as your Heart Health Month and carry out all the tips that I'm going to be giving to you in this very video. Now, tip number 4 is particularly important because tip number 4 is a challenge. Okay, I'm going to give you a 30-day challenge that I want you to take seriously because it's something that is really going to help you improve or reduce your risk of heart disease. Okay, so 4 tips. Tip number 4, very, very important. All the tips are important, it's just that tip number 4 is a challenge. So let's get the show going with tip number 1. And in tip number 1, if you are over 40 years of age and you don't have high blood pressure yet, if you've not been diagnosed with high blood pressure, then you're a very lucky person and you want to keep it that way. So for you, your main objective is to prevent high blood pressure. You want to do everything in your power to prevent high blood pressure. So prevention is your objective. And indeed, some of the things that I suggest to people who have high blood pressure, if you do some of those things, of course, high blood pressure is not going to come knocking on your door anytime soon. So prevention will be your goal. For those of us who already have high blood pressure, well, we have to take all steps, every step, to make sure that we keep those blood pressure readings down, okay? Because high blood pressure is a risk factor for heart disease. So we want to make sure that we optimize blood pressure readings, keep it as low as possible. So that's tip number 1. Oh, by the way, for those of you who don't have high blood pressure yet, it will help if you buy yourself a blood pressure monitor. So you check your blood pressure, say maybe once every 3 months, just to make sure that your blood pressure is ticking along nicely, okay? So one of that tip there for you for those of you who do not have high blood pressure yet. Now, talking about high blood pressure, well, a new video has been uploaded in my second channel, so the link is going to be right below in the very first comment below this very video. And in today's video, I'm talking about why you should have your blood pressure under control. It's an essential viewing. Go ahead, watch it, and you will be quite pleased with what I've got for you there. So link is going to be right below this video, okay? In the very first comment. Tip number 2, and this has to do with diabetes. If you are diabetic, then of course what I would suggest is you want to do your utmost best as well to make sure that you optimize your blood sugar readings, because having high blood sugar levels all the time is a risk factor for heart disease, a very potent risk factor for heart disease. So you want to make sure that your blood sugar levels are well optimized to reduce your risk of developing heart disease, okay? So make sure that your diabetes is well under control, okay? So that's tip number 2. Because diabetes is a risk factor for heart disease, okay? So you want to make sure that you have it under control. So tip number 3. Now, if you are someone who smokes, then I want to really plead with you to give up the habit, because smoking generates lots of free radicals, and free radicals lead to chronic inflammation, which damage blood vessels, you know, the walls of your arteries, and that leads to heart disease. So for the sake of your health, I would suggest that you give up smoking altogether. Join a smoking cessation program. That will go a long way in helping you quit the habit, okay? So give up smoking, please, if you are a smoker. So that's tip number 3. So let's move on to tip number 4, which is a challenge. And what I've got for you here is what I call a steps or reps challenge, similar to what we did last year. So for the steps, I want you to undertake 12,000 steps a day for the next 30 days. And that will equate to 360,000 steps over the 30 days. Okay, so 12,000 steps a day. That is your target for the next 30 days. Now, you can also do reps, and reps being repetitions. And I'm going to show you some exercises that you will undertake to get 80 reps per day, okay? 80 reps per day over 30 days. That's going to equate to 2,400 reps over the next 1 month. So to kickstart things off, here's what you do for the steps. So you can go jogging, and I want you to jog 3 miles per day over the next 30 days, okay? 3 miles per day, it's not too much to ask. Or you can walk it, okay? You can go walking and walk 3 miles per day at a speed of 3 miles per hour, okay? 3 miles per hour, so it's got to be a brisk walk. So go walking or go jogging, it's up to you. 3 miles per day over the next 30 days. That's all I ask, okay? If you want to do steps, that's the way to go. You can also include the steps you do when you're at work. So that's it for the steps. Now let's move on to the exercises that you will undertake to get your 80 reps per day. Here they are. This is subroutine number 1. You can aim to do 20 reps of these incline push-ups, but the target is 80 reps a day, okay? This is a simple one, 20. So you just go, legs out, arms there, and then go. 1, 2. 20. So that's 20 at a time. Aim to do about 80 a day. Just split them up, okay? Have a rest in between. So that's one exercise for you, and that's one of the challenges for you. And subroutine number 2. Okay, so here's another routine for you. You need dumbbells for this, and you're going to do 20 reps on each occasion. And remember, we're aiming for 80 reps a day. So we're going to do a side swing. So you just go like that and like that, okay? So let's go then. 1, 2, 3. That's it. You're going to be aiming for 80 of those a day, okay? A very small target. And subroutine number 3. Here's another routine for you. This one involves the dumbbells, and what we're going to be doing with it, well, we're going to be doing a shoulder press. So all you need to do is have the dumbbells at shoulder level like that, and then you lift them up and then back down, up and down. Okay, so 20 reps of this. So let's go. 1, 2, 3. 19, 20. See, easy. So that's 20 reps for you, and we are aiming to do about 80 a day. And subroutine number 4 for you. This one also involves the dumbbells, and what we're going to do with it, where we're going to be doing the static forward march, okay? Static forward march. So just 20 reps of this, and you're good to go. So let's go. 1, 2, 3. 18, 19, 20. That's it. Okay, so there you are. Okay, 4 exercise subroutines there for you to get your 80 reps per day. You can mix and match them. You can do steps in one day. You can do reps the next day. You can alternate it. Okay, any way it pleases you, go ahead, do that. So long as you get yourself active over the next 30 days, that's all I'm asking. Okay. In actual fact, the idea behind this challenge is for it to be a springboard for us to get active going forward. that's the whole idea behind it. Just a reminder for you guys, the new video in the second channel has been published. Don't forget to go watch it. Link is going to be right below this very video, in the very first comment below this video. Okay, so when you finish watching this video, please go ahead and go watch it. So hopefully you got some value from this video. If you did, please give the video a thumbs up, please like the video, and also please share this video with your friends, with your family and colleagues. And if you got any comments regarding the steps or the reps, which one are you going to do more, let me know in the comment section down below. As usual, I think that's about it. Until next time, well, this is Dr. Joe signing out.